Hello everyone. Welcome to this quick video on the Baby Friendly Hospital Initiative, that is BFHI. For the future nurses, understanding this global effort is key to great newborn care and breastfeeding support. So let's learn the core ideas and why they matters for healthy babies. Let's start it. So today's topic is Baby Friendly Hospital Initiative. Next, we can see the introduction. That is, the Baby Friendly Hospital Initiative, BFHI, was launched in 1991 by UNICEF and the World Health Organization. It has served as a motivating force for maternity facilities around the world to implement policies and practices that support breastfeeding. The key framework of Baby Friendly Hospital Initiative is 10 steps for evidence-based practice on exclusive breastfeeding, and it is focused on the early contact between the baby and the mother and roaming in, avoiding artificial feeding for better health outcomes. These are all the main aim of Baby Friendly Hospital Initiative. The Baby Friendly Hospital Initiative seeks to provide mothers and babies with a good start for breastfeeding, increasing the likelihood that babies will be breastfed exclusively for the first 6 months and then given appropriate complementary foods while breastfeeding continues for 2 years or beyond. That is, it is launched by WHO and UNICEF in 1991. The main goal is to promote and support the breastfeeding. Main framework of this is providing a framework for health facilities, that is 10 steps to successful breastfeeding, and the core component of BFHI is the main exclusive breastfeeding for the babies till 6 months, and the breastfeeding can continue up to 2 years or beyond with appropriate complementary feeding. This is the main aim. Next, we can move to the goal of the Baby Friendly Hospital Initiative. That is, the first one is to transform hospitals and maternity facilities through implementation of the 10 steps. That is, this means changing hospital and birth centers by putting the 10 steps to successful breastfeeding into practice. This is the main aim. And the second aim or second goal is to end the practice of distribution of free and low-cost supplies of breast milk substitute to maternity wards and hospital. Nowadays, it is common that some breast milk substitute will be available in the hospital and local markets that will be given to the newly born babies. So it should be ended by this. That is, the aim is to stop hospital and maternity wards from giving out free or cheap formulas which can discourage breastfeeding. So the 10 steps, that is 10 steps to successful breastfeeding, we can say. The first and foremost one is have a written breastfeeding policy that is routinely communicated to all healthcare staffs. That is, the hospital must have a clear written set of rules and guidelines about breastfeeding that all doctors or nurses and other healthcare workers know about, and it should be followed by them. And now it is reframed as comply fully with the International Code of Marketing of Breast Milk Substitutes, establish ongoing monitoring and data management system. That is, the hospital need to strictly follow the rules of how formula is marketed and set up system to track their breastfeeding support effort and patient data. That is, mainly have a written breastfeeding policy, and mainly it is focusing on the avoidance of other substitute of breast milk and encourage the mothers to fulfill the baby's hungry with the breast milk only. So next we can move to the second steps, that is train all the healthcare staff in skills necessary to implement this policy. That is, all hospital staff must receive the necessary training to understand and put the breastfeeding policy into practice effectively. That is, the training staff on supporting mothers to breastfeed. That is, the training all the healthcare professionals in the hospital, especially the nurses and the doctors, have a training on the breastfeeding and how to teach the mothers to be feeded the babies, and assessing health workers knowledge and skill also is the main point under this. Next, we can move to the third step, that is inform all pregnant women about the benefits and management of breastfeeding. That is, discuss the importance and management of breastfeeding with pregnant women and their families. That is the main aim. During the pregnancy itself, the mothers and the family taught regarding the benefits of the and importance of the breastfeeding for the babies and the mothers, and for the society also should be taught. So the main meaning of this point is all expectant mothers should receive information about the advantages of breastfeeding and how to do it successfully. Okay, so next we can move to the fourth point and fourth step, that is help mothers initiate breastfeeding within half an hour of birth. That is soon after the delivery. If it is normal delivery, within half an hour, and if it is cesarean section, within 1 hour, the breastfeeding have to be initiated. Now it is termed as, the step is now interpreted as place babies in skin-to-skin contact with their mothers immediately following birth of at least an hour, and encourage mothers to recognize when their babies are ready to breastfeed and offer help if needed. Within half an hour of delivery or within 1 hour of delivery, the mother and the baby should be in skin-to-skin contact, that is bedding in to be prepared. And they describe the practice of keeping mothers and their newborn together continuously for 24 hours a day, and this allows for the demand feeding. Demand feeding in the sense when the baby is having the gestures or actions like he or she is feeling hungry, then the mother should know that and develop a bonding, and the mother should start the breastfeeding. Don't wait for the 2 hours and all. So it also encourages mothers to recognize their baby's early feeding cues and breastfeed when the baby shows signs of hunger rather than on a set schedule. Okay, previously we adhered to the 2-hourly feeding. Now it is not mentioning, only when the baby is starting some cues or gestures or some actions, the mother have to identify that and feed the baby. And if the mother is need any help for the feeding, all healthcare professionals are there, so they can help them. This is the fourth step. Then the fifth step is show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. That is checking positioning, attachment and sucking of the baby. That should be monitored by the staff, and giving practical breastfeeding support when the mother is sitting on the chair for feeding. The back should be supported and the lap also should be supported with a pillow, and the baby positioned in right position, and the areola completely should be in the mouth of the baby, and giving practical breastfeeding support. And it means the teaching mothers the correct breastfeeding teaching techniques and how to keep producing milk even if they are if the babies are in emergency, so the baby can be admitted in the NICU and all. So how to express their breast and give to the baby also can be taught to the mothers. So this is the fifth step. Show mothers how to breastfeed and how to maintain lactation even if they should be separated from their infants. Then next is give newborn infants no food or drinks other than breast milk unless medically indicated. That is, the newborn should only receive breast milk and nothing else like formula, water or glucose water or something like that should not be given to the baby unless there is specific medical reason. So giving only breast milk unless there are medical reasons, then prioritizing donor human milk when a supplement is needed. If the baby needed any other supplements or other, don't give any substitute of the breast milk. We can adhere to the donor of human milk. Human milk banks are available nowadays. We can adhere to that. So this is the sixth step. Then we can move to the seventh step, that is practice rooming in. Allow mothers and infants to remain together for 24 hours a day. That is letting mothers and babies stay together day and night. That is making sure that mothers of sick babies can stay near their babies, that is nearby NICU only. So it means keeping mothers and their babies together in the same room around the clock, allowing for continuous contact and feeding on the needed time. Next is eighth step, that is encourage breastfeeding on demand. That is the older version, but now it is termed as support mothers to recognize and respond to their infants' cues for feeding. That is, previously we are saying that demand feeding, now it is cues for feeding have to identify the mothers, and if the baby is feeling hunger, then the mother should feed the baby. Don't wait for the schedule. That means supporting mothers to breastfeed their babies whenever the baby shows signs of hunger rather than following a fixed schedule. So this is the eighth step. Next we can move to the ninth step, that is give no artificial tests or pacifiers. It is otherwise called as temnis or soothers to breastfeeding infants. The breastfeeding babies should not be given any artificial nipples or pacifiers, as these can interfere with the learning to the breastfeed effectively. That is, we have to give a proper counseling to the mother that should not give any soothers or pacifier to the breastfeeding babies. It will lacify the babies to feed the breast. So next and foremost step is the last one, 10th step, that is foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. Especially nowadays, it is mainly focused on the outside of India, that is outside countries. Now in our Kerala and India, breastfeeding support groups are presently not available, but we are with ASHA workers or locally available healthcare workers. So for this step, it is meant that hospitals and clinics should help create breastfeeding support groups and connect mothers with these resources when they leave the facility. So this is the last and final step, that is referring mothers to community resources for breastfeeding support. That is, we have the ASHA workers and locally available nurses or healthcare professionals nearby our home. So if there is any doubt or any clarification, they can contact them. So this is the last step. So till now we were discussed about the 10 steps, and the main aim of these 10 steps are we have to develop a written policy and we have to practice rooming in or bedding in, that is skin to skin contact of the baby and mother, and exclusive breastfeed for the 6 months. Then how to teach, or the healthcare professional have to teach the mothers how to feed and what all the problems may occurring during the feeding and what all the positions can be attained, and the family also can be included in this. So next we can see how the recognition of the hospital as baby friendly hospital. So a hospital that conducts a minimum of 250 deliveries per year can seek recognition after implementation of the 10 steps for promotion of breastfeeding. That is, if the hospital is having 250 deliveries in a year and the hospital implementing these 10 steps, already we have discussed the 10 steps. If the hospital is implementing successfully these 10 steps, then they can go for the accreditation process. So they can fill a form, that is self-assessment form will be available, that can be filled by the hospital and they can register BFHI Secretariat for the accreditation. So when we are applying for this, the hospital and nursing home should meet the 10 criteria, that is 10 steps, and the 250 deliveries per year should be there. If we are following that particular criteria, then the assessor will be coming to our hospital to check whether it is following or what. Then they will spot check and interview the mothers and healthcare staffs whether all the criteria is meeting or not. Then they will review it and they will send back the details to the review committee of BFHI Secretariat. If we are not following, or if any hospital is not following any of these criteria, any 1 or 2 criteria are not following, then the report also will be going to the secretariat and we can reapply by rectifying it. Then after the committee review, the hospital fulfilling the national BFHI requirement are recognized as baby friendly hospital initiative. So the national task force organized a public ceremony for presentation of BFHI certificate and logo. We can depict in the entrance of the hospital and where the breastfeeding mothers are coming, there also we can place the logo. Then the hospital that are unable to fulfill, that already I have told, if it is not met the criteria, they can reapply for it and the process will be as a cyclic process. Then they will reassess, and if we are again met all the criteria, then we will be getting the BFHI certificate. So this is the accreditation process for the BFHI. So these are all about the BFHI. So today we have discussed about the Baby Friendly Hospital Initiative. It was launched in 1991. Its main goal is to improve the exclusive breastfeeding until 6 months, and it can be continued until 2 years with the adequate supplement foods, and it can be also beyond B. Then the main part of this is avoid any supplements of breast milk if unless and otherwise it is medically indicated, and correct positioning and correct breastfeeding techniques, and if there is any problem for breastfeeding, that also taught to the mothers by the healthcare professionals. So a policy can be developed by the hospital and it should be communicated to the healthcare professionals and to all staff, and that can be trained to the staff and they can implement it to the mothers also. So that's all about today's topic, that is Baby Friendly Hospital Initiative. Thank you.